Hello, everyone. Today on the Mind Maladies Podcast, we have Dr. Daniel Cruikshanks. Could you please tell us a little bit about yourself and who you are?
Sure. I am a professor of psychology and counselor education at Aquinas College in Grand Rapids, Michigan. And I serve as the director of our Master's in Clinical Mental Health Counseling program, which I started in 2016. I have been a counselor educator, that is a professor of counseling since as a full-time professor of counseling since 2000. And my teaching career goes back to the mid 1990s. And since I became, or I guess I should say, since I graduated from my master's in counseling program back in 1994, I have been a practicing clinician and have worked in a variety of settings, including hospice, a psychiatric setting, practice, and private practice as a clinical mental health counselor.
Mm-hmm. So today, the focus of today's podcast will be bipolar disorder. So could you give your own definition of bipolar disorder, what it is, and a brief introduction to the topic?
Sure. So bipolar disorder is a type of mood disorder where people can experience periods of depression. And oftentimes that depression can be pretty severe and debilitating. And then there are times when people also experience periods of mania or a really highly elevated mood. And then sometimes people can experience periods of depression and mania together, which is called a mixed manic depressive episode. And so bipolar disorder is considered one of the more severe mental and emotional problems. It can be debilitating when not properly treated, or if people are not able, don't respond well to treatment. And typically most often starts to manifest in people when they're in their teenage years or early adulthood, and can include periods of psychosis, that is periods of where they maybe hear voices or see things that aren't there, and those kinds of things. And so, yeah, it's a pretty serious, potentially debilitating problem.
So you mentioned that most people kind of see signs during their teenage years. What would you say are some of the early signs of bipolar disorder?
So we can, I guess one of the best ways to talk about this is if a person is a parent and has a child who is having problems, probably the best way to notice that something is going on is that they would see their child having serious disruptions in their ability to sleep, serious disruptions in their mood regulation. And both of these are a little bit tricky because by definition, teenagers have problems in those areas. So this would be beyond the typical disruptions in mood and sleep problems. Excessive moodiness, irritability, and if in the teenage years, we would typically see serious declines in performance at school. So a real impairment in the ability to function well in school. So those are typically the things that we would see early on. Mania, in the classic form of mania, people's energy levels become very very high, and so people may not need to sleep for extended periods of time. And then, like I said, their sleep patterns get really seriously disrupted. But again, the challenge is it's a little difficult because teenagers typically experience a lot of those things at least a little bit. And so what we're talking about is all experiencing many or all of those problems even more severely than what would typically be seen in.
So if these symptoms are recognized early on, what's the process of diagnosis and treatment from there on?
So the best kind of evidence-based practice for dealing with the diagnosis is to obviously see a professional, and that professional can be a psychologist or a clinical mental health counselor, and go through a diagnostic process. And best practices, the diagnostic process would include an extensive interview, including family history. One of the things about bipolar disorder is that it's fairly strongly genetically loaded. So it tends to be seen in families. So for example, I suffer from bipolar disorder myself. And my father has bipolar disorder. My grandfather had bipolar disorder. So it's very strongly genetically loaded. And so we tend to see it in families. And it's important to gather that history. But then also, ideally, to do some psychological testing to help to rule out other possibilities. When in any mental health diagnostic process, the biggest challenge is kind of figuring out what we're actually dealing with and ruling out other possibilities. So for example, and especially dealing with teenagers and young adults, we need to rule out that the person isn't abusing substances in a way that the symptoms that we're seeing are actually due to substance abuse rather than the mental disorder.
So you kind of mentioned and touched on the topic of like the factors that cause it. You mentioned genetics is one component.
Mm-hmm.
Is gender and maybe another component? Like, does it affect males and females disproportionately? And some other things that might cause it? Is it like a stressful environment, like how they grow up, stuff like that?
Yeah. So bipolar affects genders pretty equally. Sometimes the way that it manifests can look a little bit different in males and females, where males may tend to manifest the disorder with more aggressive behavior, where females may manifest mania with more high levels of energy and excessive activity. But basically, gender doesn't play a significant role. So it's just about kind of what do the symptoms look like? And I know I'm not answering the whole question. What were some of the other parts of your question?
Like their environment when they grow up, if it's like an abusive environment, stuff like
sure. So this is a really interesting piece of this. So as I said, it's genetically loaded. So we do tend to see that people with bipolar are more likely to have experienced abuse or neglect or trauma during childhood. And so for a long time, people thought, well, the abuse or neglect is actually what's causing the disorder. And there may be something, an element of that. So bipolar is definitely a stress-related disorder. And the more stress that people experience, and abuse and neglect and trauma, childhood trauma would all be high stress events, the more likely we are to experience symptom, to develop the disorder. The problem is, the is the question really is the increased likelihood of abuse and neglect that we experience in childhood because one or more parents or other family members also have bipolar and are therefore more likely to have difficulties regulating their mood and their behavior and therefore be more abusive. Does that make sense?
Yeah. If it's okay with you, could you speak a little bit on your experience with bipolar disorder? Because you mentioned that you have lived with it. Maybe some things that you've done to get through it and like what you felt.
Sure. I'm a child of the 70s. I was born in the 60s, but really kind of grew up in the 70s. And what's interesting in a way about that time was that in the mental health field, during the time when I was starting to have problems, the belief was that children couldn't get depressed or have something like bipolar. It really wasn't until the early 90s that we started to recognize that children could experience serious mood disorder. And so I started having problems as a pretty young kid. And in fact, my parents will talk about the idea that I was different and, excessively sensitive and moody and so on, very early on. During the time that I was growing up and having these problems, one, there wasn't really a way of understanding what that was about, and two, my parents were not functioning fantastically well themselves, and so there was really never an effort to get me any kind of help or to understand what was going on. So mostly as a kid, I was just told to snap out of it, which for people with mood disorders, we would love to be able to snap out of it, but we just can't. We don't have that kind of control over our brains. But some of the things that I talked about earlier in those kind of early signs, were very much things that I experienced. I had a really difficult time in the educational setting with school. I excelled in some areas, but I really struggled in other areas. I didn't really have behavioral problems in school, but really struggled with learning because my mood was not well regulated, and I really had problems socially as a kid. In my peer group, I was picked on a lot, bullied, things like that. And then, you asked about sort of childhood traumas, and definitely as a kid growing up, I experienced quite a bit of abuse at the hands of my parents. And so all of those things, kind of came together to really compounded, I guess I should say, to cause significant problems. So it really wasn't until I was in my early 20s that my bipolar was finally diagnosed. I was initially misdiagnosed with just major depressive disorder and treated for that. And those treatments didn't really help. And eventually was diagnosed with bipolar disorder, and the treatments were adjusted and things started to come around and get better.
Yeah, thank you for sharing that. So you also talked about like some of the stigma around bipolar disorder while you were growing up. So I think you would have a lot of experience with this next question. So what do you think are some of the most common misconceptions of bipolar disorder?
Yeah. So first of all, I think one of the big ones is that people with bipolar are crazy, and people with bipolar disorder are not crazy. People with bipolar disorder are experiencing an illness that affects the brain and makes it difficult for the brain to regulate itself in ways that affect us in the ways that I've talked about: mood, sleep regulation, all those kinds of things. So, big misconception that we're crazy. We're not crazy. And then I think another misconception for people who are either dealing with bipolar or family members of people who are dealing with bipolar is that somehow we have control over what we're experiencing and what we can do about it. And as I said, when I was growing up, if I had $1 for every time I was told to snap out of it, I'd be wealthy right now. And I would love to have been able to snap out of it, and that just wasn't possible. I was kind of held hostage by my brain. So once we get to a point where we have a diagnosis and have treatment options available to us, then we do have some control in the sense that we can decide whether to pursue treatment and what treatments to pursue. We can work with our physician and other providers on that. And so unfortunately, some people choose not to pursue treatment, and then that becomes a problem. But most people with bipolar are desperate to find something to help, and when they are given the opportunity, when we have viable treatments available, we will absolutely pursue those.
So on the topic of treatment you were just talking about, how has treatment changed from when you were growing up, and how is it continuing to change?
Yeah, that's a great question. So one of the things that's really interesting about bipolar disorder is that that it was actually the first, depending on the history, because these two things happen pretty close together, but bipolar disorder was the first disorder for which we had medical treatments available in the form of lithium. Mm-hmm. So when lithium was discovered as a treatment for bipolar back in the early 1950s, we started to see opportunities for help. Now, one of the challenges is that in the United States, because of an unrelated lithium scare, where at some point, somebody decided that lithium, because lithium is basically a salt, it's a naturally mm-hmm. occurring salt. Somebody decided that lithium could be a substitute for regular table salt, and a bunch of people ended up getting poisoned by that with toxic levels of lithium, and that was a problem. So side note, people kind of got scared off of lithium for a while. So lithium became a viable treatment for bipolar. It really didn't start to be used a lot until the 1970s, the early 1970s. But it was and is still an extraordinarily effective treatment. The challenge with lithium is that not everybody responds to it, or there are people who can't tolerate it because they have sort of toxic side effects from it. And so more recently, and we're going back to maybe the late 80s, early 1990s, we started seeing a move from lithium to the use of anti-seizure medications the same medications that effectively treat epilepsy and other seizure disorders also help regulate the mood in people with bipolar disorders. So there was a period in the 90s and to the early 2000s where those anti-seizure medications were the sort of the first choice in medical treatment for bipolar. And then more recently, we kind of shifted more into the use of antipsychotic medications. And the challenge with that is that very often, if I start talking to one of my patients about, you have bipolar and these are the, we need to get you evaluated for medications, and these are the kind of first choice medications. If we talk about antipsychotics, people really freak out about that. And they think, are you saying that I'm psychotic? Are you saying I'm crazy? And they just really get uncomfortable. So, I have found that I have to kind of talk with my patients in a way that sort of helps them understand that term antipsychotic is a little bit of a misnomer, that what we're really talking about is using a medication that will help regulate dopamine, which is one of the key neural pathways involved with mood and mood regulation. But antipsychotic medications have been found to be very helpful. And typically, what in more recent years, what we've seen is that combinations of several different medications working together seem to be most effective. So maybe an antidepressant to deal with the depression symptoms, an antipsychotic or one of the other mood stabilizers to deal with regulating mania and so on. Unfortunately, with few exceptions, we really haven't seen dramatic changes in how we approach treating problems like bipolar disorder. The technology hasn't changed a lot. We have had some beneficial effects or benefits with things like neurofeedback and biofeedback. Effective counseling or psychotherapy is really important to help people learn how to manage the disorder and manage stress in their lives and deal with their relationships. Because as you can imagine, when your mood is dysregulated and you have irritability and excessive energy at times or depression at times, it really has huge impacts on relationships. So effective psychotherapy is really important. In my own case, there's recent research that has found that things like certain kinds of probiotics help reduce symptoms, and B vitamins, B complex vitamins help. And vitamin D is very important. A lot of times people with mood disorders are found to have low levels of vitamin D, especially in the wintertime. So when I work with my patients, I talk with them about all of those kinds of things as well. And we are seeing the advent of some new technologies that are just coming online or just down the road, such as magnetic stimulations. Transcranial magnetic stimulation is just coming out and does appear to help some people. And there's some research being done with a new kind of neural implant, where an implant is put in a certain area of the brain and then hooked to a device that's kind of like a pacemaker. Too early to tell how much that's going to help yet.
Yeah, so really quick, because I do want to come back to this topic, but can you really quickly go over the types of bipolar disorders there are?
Sure. So basically, there's bipolar 1 and bipolar 2, and bipolar 1 and bipolar 2 are very similar. The primary difference between bipolar 1 and bipolar 2 is that bipolar 2 people with bipolar 2 tend to have less intense manic episodes or mania. So people with bipolar 1 can have very very intense mania that can even they can even experience periods of psychosis. And so when we talk about mania, it's important to remember what we're talking about is, in a sense, sort of psychic energy or mental energy. And so, we all have ebbs and flows in our energy normally. You have periods where you feel more energetic and periods where you feel lower energy. So people with bipolar 1, when they have mania, it's kind of like if the normal person experiences ebbs and flows on a volume button of sort of 4 to 6 or 3 to 7 maybe, people with bipolar, when we're in a manic episode, can have an 11 or 12 on the volume level when the top of the scale is kind of 10. Mm-hmm. People with bipolar 2 tend to have what we call hypomanic episodes. So it's a little bit less intense, and but otherwise all the same symptoms. And then there's another form of the disorder called cyclothymia, which is much less common, or it's thought to be much less common, which is a milder form of the disorder, but characterized by very prolonged periods of time symptomatic. So longer periods of time with symptoms, but the symptoms, both the depressive symptoms and the manic symptoms, tend to be less intense.
So what should someone do if they feel like they're experiencing symptoms of mania or depression in any kinds of these bipolar disorders?
Yeah, so that's a great question. So the first part of answering that is really to mention that one of the common characteristics of people with bipolar disorder is that when we are symptomatic, especially when we're in more of the manic side of the symptom episodes, is that we don't have good insight into our own mental state. So, for example, in my own case, my symptoms are, mostly regulated most of the time. I've gotten to a pretty good place, but there are times when, especially under prolonged stress, that my symptoms start to come up a bit. And a lot of times I am completely unaware of it. And so I really have to look to my spouse to let me know, and trust my spouse when she starts to tell me things like, hey, did you forget your medications? Are you doing okay? You seem a little, you seem like your energy is kind of kicking up. And so, a lot of times people with bipolar disorder the disorder is more obvious to people around us than it is to ourselves. And that can make it really challenging to deal with, because I might not know that I'm ill and be behaving erratically or out of control and not really realize it. But so if a person is suspected that they might have a mood disorder and other people close to them are saying, you need help, we need to listen to that. But when, getting back to your question, when we suspect that there's a problem, it's really critical to get into a qualified mental health professional. whether that's a licensed professional counselor or a licensed psychologist or a psychiatrist. It's really important to get help, to get evaluated, and get the diagnosis. It's not as helpful to go to one's primary care physician, because those folks tend to have less training and less knowledge and understanding and expertise about the disorder. But it's very common. So we're more likely to get misdiagnosed if we go to our primary care physician. For example, and this was true in my own case, I went to my doctor and said, I'm having these problems. And my doctor said, oh, it seems like you must have depression, and put me on medication, an antidepressant, which was fine. And that started to help with the depression. But then that triggered a significant manic episode. And then I was manic for many months. And during that period of mania, I engaged in a whole bunch of, problem behaviors that were disruptive to my life and to other people's lives. So had I been, treated by a psychiatrist initially, I probably could have had those medications monitored more carefully. I could have had a mood stabilizer of some kind. In those days, it would have been probably lithium, but it would have saved a lot of grief.
So you kind of spoke on how your spouse kind of informs you when you're acting differently. So can you talk more about that and what someone can do to help other people that they know have bipolar disorder?
Yeah. So I often tell my patients, being especially a significant other to somebody with bipolar is really, really challenging. Because, once it gets effectively treated and is controlled, it's not so bad, but it can be, and frankly, it can be pretty much normal. But in the period where there's acute illness that's not controlled or treated effectively, it can be extremely difficult and stressful for family members. So, and a lot of times, people don't really realize what's going on. They just see somebody who's angry, aggressive, moody, irritable, unpredictable, sometimes, sullen and depressed, and other times, on edge and so on. But it's really important, so one thing that's really important is, as you're getting help, it's really important for family members to be involved, so that we can kind of help the family member, the significant other, spouse or significant other, understand the disorder, understand how it works, understand what to look for, and how to help communicate with their loved one about symptoms, or to communicate with the treatment provider. There are lots of times when I'm working with patients where the spouse will let me know, hey, my significant other is kind of having more problems, and we need to deal with this. So it's a lot of feedback and observation and feedback and communication to kind of make sure that we all are on the same page and understanding what's going on. And then then a big thing is, as symptoms happen, so in my own case, as I said, my symptoms have been well regulated for many years now. But it's dealing with something like bipolar. It's like managing diabetes. it's a lifelong process. And, medications stop working effectively, so they need to be adjusted or changed. Um, you know, Stress is constantly changing, and that can have effects on the effectivity of the medication or the dosing and so forth. So, so it's really kind of a constant management. So as I said before, I have learned, and it took me a while to kind of get to this place, but I've learned that, if my spouse asks if I'm okay, that I really need to pay attention to that. And make adjustments as quickly as possible. So if I'm starting to get more energized, if I'm starting to have some breakthrough mania, which is typically what happens to me, then I bump up my mood stabilizer a little bit. And sometimes I can get away with just bumping it up for a week, and then, things settle down, and I'm okay to go back to my lower dose again. But it's sort of when symptoms start to become acute, the quicker we deal with them, the better.
Do you have any words of advice for people struggling with bipolar disorder?
Yeah, I mean, I think don't be. I think I came of age at a time when mental illness was so stigmatized that that people with mental illness were very much afraid to talk about it. I did not talk openly about my mental illness until within the last sort of 15 years or so. So I think there's still some people still feel stigmatized, but one of the things that has happened as a result of the COVID pandemic, is that there's been more and more open talk about mental health and mental illness and the struggles that people have, and I think that's fantastic. Mm-hmm. So it's really important not to feel ashamed about having mental and emotional problems. They should be seen as no different than having something like diabetes or cancer or anything else. It's a healthcare problem that once we're aware of it, we can deal with it, we can treat it, we can work with it, and it's not a big, huge deal. So don't be afraid of it. Don't feel ashamed. Don't feel guilty. But do get help. It's normal for people to have variations in their mood. Some down times and some up times. But if somebody starts to feel, very depressed for extended periods of time, more than a couple of weeks or so, something's probably wrong. And if similarly, if we have real high elevations in mood, and it's affecting our ability to function at work, and it's affecting our ability to function in our relationships, or our ability to function in school, then that's a significant problem. And if it's lasting more than a couple weeks, or if it's really severe, and lasting even more than a week or so, then we need to get help. That's an urgent situation.
Yeah, that sounds like fantastic advice, and I hope at least like maybe some viewers or listeners can use that advice to improve their life. A question that I always like to ask at the end of my podcast is, what steps do you think should be taken to kind of remove the stigma surrounding bipolar disorder specifically?
Yeah, I think, steps that can be taken. That's a good question. I think that more openly talking about it, so that it's demystified. So for those of us who have mental and emotional problems, come out of the shadows, talk about it when you feel safe to talk about it, and talk about it in practical terms, like I've been doing here today.
Yeah.
So that we can take the mystery out of it and move it into the light where we can deal with it. Like I said, it's I think of my own issues with bipolar disorder as being a healthcare problem, like a managed healthcare problem like any other kind of problem. And we never hear people who talk about their diabetes feeling ashamed and stigmatized about their diabetes, and it should be exactly the same for mental illness.
Yeah, I agree. Hopefully in the future, mental health is destigmatized to a point where people can openly talk about anything they want.
Yep.
Yeah, so thank you for coming on the podcast. It was a pleasure talking to you today.
You're welcome.
Thank you for your time.
Absolutely. Take care.
Thank you guys for listening. Make sure you check out the link in the description to the Mind Maladies website. See you guys in the next episode.